Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. A nurse assigned to care for a postoperative male client who has diabetes mellitus. During the assessment interview, the client reports that he is impotent and says that he is concerned about its effect on his marriage. In planning this client's care, the most appropriate intervention would be to: Option A. Encourage the client to ask questions about personal sexuality. Option B. Provide time for privacy. Option C. Provide support for the spouse or significant other. Option D. Suggest referral to a sex counselor or other appropriate professional. Right answer is Option D. Suggest referral to a sex counselor or other appropriate professional. The nurse should refer this client to a sex counselor or other professional. Making appropriate referrals is a valid part of planning the client's care. The nurse doesn't normally provide sex counseling. Therefore, providing time for privacy and providing support for the spouse or significant other are important, but not as important as referring the client to a sex counselor. Using Abraham Maslow's hierarchy of human needs, a nurse assigns highest priority to which client need. Option A. Security. Option B. Elimination. Option C. Safety. Option D. Belonging. Right answer is Option B. Elimination. According to Maslow, elimination is a first level or physiological need, and therefore takes priority over all other needs. Security and safety are second-level needs. Belonging is a third-level need. Second and third-level needs can be met only after a client's first-level needs have been satisfied. A male client is on prolonged bed rest, has developed a pressure ulcer. The wound shows no signs of healing even though the client has received skin care and has been turned every 2 hours. Which factor is most likely responsible for the failure to heal? Option A. Inadequate vitamin D intake. Option B. Inadequate protein intake. Option C. Inadequate massaging of the affected area. Option D. Low calcium level. Right answer is Option B. Inadequate protein intake. A client on bed rest suffers from a lack of movement and a negative nitrogen balance. Therefore, inadequate protein intake impairs wound healing. Inadequate vitamin D intake and low calcium levels aren't factors in poor healing for this client. A pressure ulcer should never be massaged. A female client who received general anesthesia returns from surgery. Postoperatively, which nursing diagnosis takes highest priority for this client? Option A. Acute pain related to surgery. Option B. Deficient fluid volume related to blood and fluid loss from surgery. Option C. Impaired physical mobility related to surgery. Option D. Risk for aspiration related to anesthesia. Right answer is Option D. Risk for aspiration related to anesthesia. Risk for aspiration related to anesthesia takes priority for THIN's client because general anesthesia may impair the gag and swallowing reflexes, possibly leading to aspiration. The other options, although important, are secondary. The nurse inspects a client's back and notices small hemorrhagic spots. The nurse documents that the client has: Option A. Extravasation. Option B. Osteomalacia. Option C. Petechiae. Option D. Uremia. Right answer is Option C. Petechiae. Petechiae are small hemorrhagic spots. Extravasation is the leakage of fluid in the interstitial space. Osteomalacia is the softening of bone tissue. Uremia is an excess of urea and other nitrogen products in the blood. Which document addresses the client's right to information, informed consent, and treatment refusal? Option A. Standard of nursing practice. Option B. Patient's Bill of Rights. Option C. Nurse Practice Act. Option D. Code for Nurses. Right answer is Option B. Patient's Bill of Rights. The Patient's Bill of Rights addresses the client's right to information, informed consent, timely responses to requests for services, and treatment refusal. A legal document, it serves as a guideline for the nurse's decision-making. Standards of nursing practice, the Nurse Practice Act, and the Code for Nurses contain nursing practice parameters and primarily describe the use of the nursing process in providing care. If a blood pressure cuff is too small for a client, blood pressure readings taken with such a cuff may do which of the following? Option A. Fail to show changes in blood pressure. Option B. Produce a false high measurement. Option C. Cause sciatic nerve damage. Option D. Produce a false low measurement. Right answer is Option B. Produce a false high measurement. Using an undersized blood pressure cuff produces a falsely elevated blood pressure because the cuff can't record brachial artery measurements unless it's excessively inflated. The sciatic nerve wouldn't be damaged by hyperinflation of the blood pressure cuff because the sciatic nerve is located in the lower extremity. Nurse Elijah has been teaching a client about a high-protein diet. The teaching is successful if the client identifies which meal as high in protein. Option A. Baked beans, hamburger, and milk. Option B. Spaghetti with cream sauce, broccoli, and tea. Option C. Bouillon, spinach, and soda. Option D. Chicken cutlet, spinach, and soda. Right answer is Option A. Baked beans, hamburger, and milk. Baked beans, hamburger, and milk are all excellent sources of protein. The spaghetti broccoli tea choice is high in carbohydrates. The bouillon spinach soda choice provides liquid and sodium as well as some iron, vitamins, and carbohydrates. Chicken provides protein, but the chicken spinach soda combination provides less protein than the baked beans hamburger milk selection. A male client is admitted to the hospital with blunt chest trauma after a motor vehicle accident. The first nursing priority for this client would be to Option A. Assess the client's airway. Option B. Provide pain relief. Option C. Encourage deep breathing and coughing. Option D. Splint the chest wall with a pillow. Right answer is Option A. Assess the client's airway. The first priority is to evaluate airway patency before assessing for signs of obstruction, sternal retraction, stridor, or wheezing. Airway management is always the nurse's first priority. Pain management and splinting are important for the client's comfort, but would come after airway assessment. Coughing and deep breathing may be contraindicated if the client has internal bleeding and other injuries. A newly hired charge nurse assesses the staff nurses as competent individually but ineffective and non-productive as a team. In addressing her concern, the charge nurse should understand that the usual reason for such a situation is Option A. Unhappiness about the charge in leadership. Option B. Unexpected feeling and emotions among the staff. Option C. Fatigue from overwork and understaffing. Option D. Failure to incorporate staff in decision-making. Right answer is Option B. Unexpected feeling and emotions among the staff. The usual or most prevalent reason for lack of productivity in a group of competent nurses is inadequate communication or a situation in which the nurses have unexpected feeling and emotions. Although the other options could be contributing to the problematic situation, they are less likely to be the cause. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.